Kericho hamjambo. Kericho chamgei. Omune. Kericho Bwana Yesu asifiwe. Hebu mnisalimie hewani nione hivi watu wa Kericho. Asanteni sana. Mashujaa Day is a celebration of the power of individuals to change the course of history and the destiny of a nation. It is a reminder that nations are driven forward and changed by individuals, ordinary men and women who believe they can make a difference and who believe they can change the status quo. The status quo in 1963 was a colonial state, the denial of basic freedoms and dignity. Deep inside many individuals then, they believed change was necessary and they took action. Individuals' belief resulted in action and ultimate progress that made us the people we are today, an independent, democratic, progressive nation. Today, the status quo is a hunger for socio-economic transformation, one that most of us feel is long overdue, and we are rightfully so. The need for heroism is as urgent as it was in pre-independence Kenya. The power of individual action is still as powerful today as it was then. Our heroes today are on the farms, the markets, in factories, in offices, in construction sites, and in many other places. Our heroes are using their creativity to create content and shape culture. They are playing on fields, running on tracks, and working across many other fields. Every day, when we do our best, when we deploy our diligence, intellect, passion, creativity, hard work, and the sense of purpose, every day that we believe we can make a difference, we are changing our country. This is our call to Mashujaa, to the best of us, to be the best of us every day and to move our nation forward. This is why we are focused on empowering Kenyans to be at their best on diverse fields by democratizing and innovating government services to ensure that we give as many Kenyans as possible the opportunity to be their best so that they can move our country, our nation forward into a destiny that we all share as a people. The Constitution guarantees Kenyans the right to the highest standards of health. Since independence, successive governments have made efforts in guaranteeing access to quality and affordable health care for Kenyans, but with limited success. There have been several attempts and efforts to achieve universal health coverage, one in 2003, in 2013, and in 2018. However, these efforts were met with little success. It is for this reason that the government of Kenya identified healthcare delivery as one of the core pillars of the bottom-up economic transformation agenda. In the Kenya Kwanza Manifesto, we made several commitments towards the delivery of universal health coverage. These include the provision of a fully public financed primary health care, the installation of a digital health management information system, and the setting up of a fund for improving healthcare facilities across Kenya. Other commitments were the setting up of an emergency medical treatment fund, the establishment of a national insurance fund that covers all Kenyans, and the availability of medical staff who would deliver on this great universal health coverage that has been in the works for a long time. The government has instituted a paradigm shift to preventive and promotive health rather than where we've been at curative health. This approach also makes economic sense. Community health reports state that for every 1 shilling invested in community health, 9 shillings and 40 cents are realized in economic and social gains in our society. In our plan, delivery of primary health services at community level will start with community health promoters, and we are very proud that they are represented in large numbers today in this very important Mashujaa Day. The work of the promoters will include basic preventive and promotive health, health education, basic first aid for the treatment of minor injuries and ailments at household level, and referral for facility-based health care. Each community health promoter is allocated 100 homes within their neighborhoods, and this will happen countrywide. Considering the pivotal role played by community health in attainment of universal health coverage, the long-term financial viability and sustainability of community health is contingent on enhanced domestic resources for health. The national government is working closely with our county governments to strengthen the delivery of community health services through the payment of stipends for the 100,000 community health promoters. This will be done on a matching basis, 50% contributed by the national government and 50% contributed by the county governments. The national government has already allocated Kenya shillings 3 billion annually for payment of these stipends, and it is my belief that counties will match up this fund so that we can enable these great heroes of our time to help us on the delivery of community health at the household level. It is worth noting